Okay, it's noon. We're going to go ahead and get started. Welcome everybody to our second webinar of the year. Today we're going to talk about prior authorizations and case management. For anyone who is not familiar with me, I think I've met pretty much everybody, at least over the phone. My name is Rachel Thaler, and I am Member Services Director. So the first thing that I want to talk with you guys about is a tax ID or NPI. Whenever I get a call from somebody asking about an authorization, they're getting kind of stuck on something. Most of the time, the problem can be solved by just correcting the tax ID. So if you're getting an authorization, you always use your facility NPI. The tax ID or TIN is going to depend on who the contract owner is. That's when you can refer to the contract summary that Bradley Parker sends out. This is a sample of what it looks like. If you look to the last column, you'll see which tax ID would be used. So if it says facility tax ID, you're going to use yours. If this says Access Advantage tax ID, you're going to use ours, and that's going to be provided for you. If you use your tax ID for a contract that is owned by Access Advantage, you're likely not going to get an authorization. If by chance you do get an authorization, when it comes time for the claim to be sent in, it's going to be denied, and they're going to have to do a corrected claim, and it can be kind of difficult. So making sure you get this right at the very beginning is important. If by chance you do need a contract summary, just email the service box. We'll give you that address at the end, and Bradley will be happy to send that to you. So the first step when you're getting an authorization is to verify benefits and eligibility. You want to make sure that the patient you're bringing into your facility has an active plan, and not just an active plan, but has skilled nursing benefits as part of their plan. You can check this through Waystar, Availity, or some of the payers have a specific portal or a phone number that you call to check things. If you have questions about how to do that, you can always reach out to us, or you can check the provider reference guide. We call it a PRG, and that should be in the white binder we provided to each facility when you became a member of Access Advantage. If you need one of those, you can also reach out to the service box, and you can have one sent to you. So, give me 1 second. I need to mute a few people that had just joined, guys. Sorry.
Yeah, it was Tony. Sorry.
So when you're verifying the benefits before bringing somebody into your facility, one thing you want to make sure of is the plan is effective, that they have a good effective date and it's an active plan. You want to ask what the out-of-pocket max is, and if anything's been met. If there's a copay, co-insurance, or deductible, and that's going to let the patient know how much their responsibility is going to be when they're staying at your facility. You want to ask what the benefit limit is, if there is one. Often it's 100 days per calendar year, but that does vary on the plan. I've seen Medicaid plans that have no benefit limit. That's important to know to see how long they would be able to stay with you before they would be a private pay. And ask if the pre-cert is required. I've yet to see a policy that does not require a pre-cert, but they could be out there. And also, if any of these skilled nursing days have been used. If there's any skilled nursing days that have been used already and there's a benefit limit, that's important for you to know, because that will be cutting into the amount of days that you have at your facility. So what do you want to submit to the payer when you're trying to get a pre-cert? The face sheet is very important. That gives the patient demographics. The H&P or history and physical to let the payer know the background of the patient. Any physician orders from the hospital, recent progress notes, vitals, therapy notes. And it's important to make sure that those are within 24 to 48 hours, within 24 hours, if at all possible, so they can get the most recent snapshot of what's going on with the patient. Any labs, if they're being treated for abnormal values, and admitting diagnosis or ICD-10 code. Prior level function is very important, especially for the initial pre-cert, because they're going to want to know the level of assistance, ADLs, transfers, how they're ambulating at home, to see what's going to take at the facility to get them back to where they were. And the home environment is important too. Depending on what the patient is at the facility for, they may not be able to return to the home. If there's stairs, they're not able to walk. See if there's a first floor setup, if there's a caregiver available. There's a lot of factors to be considered. And then if there's a medical appointment that's coming up, whether it's orthopedic, infectious disease, wound care specialist, that's important for the payer to know as well. There's some more specific things that not a lot of patients are going to have, but it is important to give as many details as you can. So if there's a wound, giving the dressing, the treatment, the stage, measurement, that's all really important so that the payer can measure as they give the updates if if things are progressing. If there's a wound back, at the pre-cert, you're going to want to try to ask for a carve out if the payer will do that. That's going to save you some money in the beginning. For feeding tubes, the date it was placed, the rate, goal type, or the goal rate, amount, type, weights, tolerating, how the patient's tolerating it. That's all important for them to know as well, to kind of see what the goal is for this patient and how things are going with that. IV, if there's the dosages, the start and stop date are important. That can determine how long they're going to be at the facility if they're going for IV administration. The frequency is in the route. For respiratory, if there's oxygen, how many liters, if there's a trach, the data was inserted, suction frequency goal, those sort of things. And for any facility that accepts TPN, I know several don't, but if you do, the access point, the stop date, rate, and how the patient is tolerating it. These are all things that the payer is going to want to know. And if you admit that in the beginning, it very much could delay your authorization and the speed of the time that it's going to get the patient to your facility. So when you do get the approval from the payer, things that you want to make sure that you get to move forward is the restart date. You also want to get the authorization number. It's going to be especially important when it comes to the claim, which we will talk about later on. The level, the PDM, whatever the payment structure is, you want to understand what that is going to be for this patient. And the case manager name, phone, and fax, so you can make sure you get it to the correct person timely to get the authorization extended. And if the patient has to go to the hospital or leaves AMA or transitions to hospice or for any reason is not having a skilled stay, you want to make sure you notify the payer of this discharge. The reason for that is because you may need to get an additional prior authorization if the patient returns. Failing to do so could result in non-payment. So when it's time for the patient to go home, if it's a Medicare Advantage plan, you're going to receive a NOM-NOC, which is a notice of Medicare non-coverage. This is a 48-hour notice for the patient to return home. It is extremely important that it is signed the same day it's received. Some payers can send up to 8 or 9 o'clock at night. They technically can send it up to 11:59 p.m. to have it signed. But it must be signed by the patient or the representative the patient is unable to sign. Timely return of this will avoid loss of payment on your end. If a denial is made for an initial research, or if a cut is given, then you can do a peer-to-peer, which would be the physician talking with the physician at the if you have a peer-to-peer appeal, there is a time frame that they will give you that you have to do this. For Medicaid or commercial plans, a 48-hour notice is not required. So you could get same-day notice the patient is going to be going home and have no more coverage. So some tips and tricks that we have come across in working with the payers. I want to be sure to share this. I have seen some Medicaid plans, especially that give you an option when you're filling out their forms. For skilled nursing stay coming from the hospital, mark urgent. The payers actually told me this. It was Melina that told me this was important to do. Otherwise, you're going to be looking up to 2 weeks of waiting for an authorization to take place. Details are important. As I mentioned with the initial auth and for the research, as much detail as you can provide them is going to increase the chance of you having a higher payment. But I will caution you, when you send the information to the payer, don't send 50 to 100 pages. Just send the most recent information, the most pertinent information. But for anything that's going to possibly get you a higher payment structure, you want to include that kind of information. And as I mentioned, missing information may and probably will delay your approval. Be sure to use payer-specific forms or portals. So one payer or two payers that I know of that are very particular about this are Anthem and Paramount. If you do not use their form, they will just kick everything back and ask for you to use their form. If it's not completed, even say if there's an IV and you have not put the stop date for the IV, they will kick it back and ask for you to complete that. So to avoid having delays or denials, make sure that you do that. And avoiding interstate denial with a timely update. Again, Anthem is one that if you do not turn in the update by 5 p.m. on the last covered day, you will get an interstate denial, meaning you will not get paid for that day. So make sure you do that. Other payers are more lenient on that, but they do want it by the last covered day. So do try to adhere to the day that they want the update. Usually for some payers, it will be the day before the last covered day. Some is the same day as last covered day. So just make sure you get that information at the research and that you follow through with that. And when you're getting the research dates for the extension, confirm the approval dates and make sure that it aligns. So for example, if you have a last covered day of May 17th and you get a research and the research begins on May 19th, you want to question why May 18th wasn't covered. It could have just been an error. But by correcting that in the very beginning on the front end, it's going to create a lot of pain or going to avoid a lot of pain when it comes to filing the claims. And please know that you can request a higher level of care at any time. Share a change in condition at any time, and that can help also increase the payment that you're going to receive. You don't have to wait for the research date to do that. And I mentioned this earlier, but notify the payer of a hospital visit or any kind of discharge. That way they can start following the patient at the hospital. And also when it's time for them to come back to you, if that happens, then you can work with the payer to get a research. Some payers will allow you to use the same authorization number, depending on how long the patient's been out. But usually we do need to get a new authorization number, especially if it's been an overnight stay. And just want to stress the returning of the nom-knock. Make sure that is done in a timely fashion. I have seen where one was not turned in the same day, it was turned in the next day, and the payer did extend the 48 hours for the patient. So they had their 48 hours of notice, but the facility did not get paid for the extra day. And lastly, be sure to provide post-discharge documentation. Certain payers require certain information after the patient has discharged. I know Anthem wants to know what the medication list the patient was sent home with. They require that after the discharge. Where Humana wants to have more specific information when it has to do with therapy. So just know what they're wanting at the very end and provide that to them, because that could also delay you or prevent you from getting payment for the stay. So that's all I had at the beginning with prior authorizations and case management. I am going to pass things over to Romaine Roberts. She's our Director of Operations, and she's going to talk a little bit about claims, billing, and denials, and what you can do to avoid the denials and the headaches when it comes to billing.
So the first thing to note is that authorizations are required for payment, but it is not a guarantee of payment. So you'll need to submit a clean claim to still be paid for the authorized services, as well as file the claim timely. So you want to make sure that all of your ducks are in a row as far as the other billing requirements or the authorization is null and void. A few reasons why you might end up with an authorization denial is number one, the authorization doesn't match the services that are billed. I'm actually starting to see an uptick in this type of denial. And it kind of comes from either you miss your recert date and the services were changed for the recertification, and you missed putting it on the claim, or you requested a service to be authorized and the payer authorized a different service than what was requested. So it's very important that you actually make sure that you are being authorized for the services that you requested. Another reason is that the authorization has expired. So like I mentioned before, you missed your recert date, or you simply did not, you had the patient stay longer than you were expecting and didn't reach out to the payer. There's no authorization on file that matches the billing provider. As Rachel mentioned, it's very important that you always use the facility NPI. And if it is an AA contract, that you use our 10. You can always refer to your contract summary to make sure that you're obtaining your authorization with the correct 10 and NPI combination. And lastly, the authorization is just simply not on file. So what do you do about your authorization denials? There are a few ways to approach this. You can submit a clean claim, or basically just submit the claim the way the services were actually authorized. We put a few things in place so that you can head off these authorization denials before you actually bill the claim. So you'll notice that when you upload your claim batches now, Waystar is going to reject your claim if you don't have any authorization information in the appropriate box. If you are billing and you feel that your service does not require an authorization, just simply type in no auth required, and that will allow you to get your batch uploaded. The next thing is you've actually received a denial and you need to submit a corrected claim. I am actually suggesting that you submit a corrected claim versus doing the medical records off the break, because the clock is ticking. And so you may miss your opportunity to file a corrected claim because you've been pursuing medical record review. If the medical records do not warrant the services that were actually billed, then now you have absolutely no payment. And you've missed your window of opportunity to submit a corrected claim and get the lower payment for the services that were actually authorized. Alternatively, you can reach out to the payer and have the authorization corrected if there was an error. Lastly, if you find that your authorization just simply doesn't match, and if there was an error on the end of the payer, we can appeal the authorization, and that is when we would go on ahead and submit the medical records to the payer for review. But as I already stated, it is best to start with a corrected claim and get some payment in the door. This is our notice of authorization denial. This is what we'll be sending out when we receive no payment or an underpayment due to an authorization denial. You'll notice that there are several reasons why the authorization has been denied, and some options as to how you can get that corrected. If you receive one of these, simply read the highlighted area and submit your corrected claim to the service box. Which brings us to a few housekeeping things. Firstly, we want to talk about corrected claims. Please do not upload your corrected claims to Waystar. We have a protocol for corrected claims, and that is to submit the claims to the service box. I'll have an example of how you can do that on the next slide, but you would send the corrected claims with the appropriate subject line, noting that it's a corrected claim to our service at accesselite.com, which is our service box. If we do decide to go with the medical records, you'll be asked to send in medical records, and please send those records to the medical records box for only the services that need to be appealed with the provider. So therapy notes versus medical records. If there's an auth denial and we're requesting medical records for a particular therapy service, like there's a partial denial on the claim, we would ask for therapy notes to support why you should receive payment for those particular dates of service. And so you would want to send in just a snapshot of what was going on during that date of service versus the entire medical record. And you can send those medical records over to our medical records box at medicalrecords@accesselite.com. So this is the sample corrected claim that I talked about. On the left here, you will see that the original claim is in red. This is the claim that needs to be corrected. You would simply print out your claim, mark up the areas that need to be corrected clearly, writing in what it should be corrected to, crossing out what should be corrected, and just send that over to the service box, and we'll get that submitted for you. If ever you are questioning exactly what's needed by a particular payer, as Rachel mentioned, we send over provider reference guides and we update them. So when you get your provider reference guide, or PRG as we refer to them, there is a prior auth section that will tell you who you need to submit your authorization information to, how you can go about verifying eligibility and benefits, and any payer-specific information that you'll need for your authorizations. So this concludes our second Lunch and Learn, and I thank you all for attending and letting us serve you. If you have any questions,